Thank you for that humbling introduction. To say the least, I mean, this kind of sets the expectation a little high for the talk, so I just want everybody to calm down, okay? So I think if we all kind of bring the expectations down a little bit, this is going to be, everybody's going to be happy at the end, okay? All right, so, you know, about 4.5 years ago, I was sitting in the back over there where, you know, prime intern sitting on the floor, and kind of listening to Dr. Andres Crowley give a talk about the midnight appy and do we really need to do it. And he gave a great speech. You know, he was very eloquent in the way he gave it, and he was very knowledgeable about it. And I felt at that time, you know, when it's time for me to give grand rounds, I want to be able to talk about something I actually know about. So I should probably pick a subject in my first year. Well, those of you that know me know that I'm a huge procrastinator. And it wasn't until fourth year where I was sent to Puerto Rico that I gave grand rounds on blunt traumatic aortic injury. I thought I was the expert because, you know, I had done the most out of my peers, and I felt pretty comfortable with it. But then we hired Dr. Joe DeBose, and he gave grand rounds on blunt traumatic aortic injury, and I realized that I can place a traumatic aortic graft or a TVAR, and that was about it. So I decided that blunt traumatic aortic injury was a great target for me to do as a fourth year in Puerto Rico. However, coming over to UC Davis with the expert that writes papers on Verboa was probably something that I should probably take a step back from. And but then July came about, and we saw that there was a lot of in the July timeframe. We saw that there was the mass attack in Orlando, where about 100 people, 50 injured, about 50 dead, came about in the Pulse Club, and started thinking about all the mass shootings that had occurred prior to this in the last 15 or so years. And one thing was always apparent when I had discussions with either my colleagues or civilians about gunshot wounds, and it was that the knowledge of this was kind of not always up to par with what is actually going on in the world, and what can we expect to see our patients show up to the hospital with. All the way from EMS to us in the ER taking care of these patients to post-op care. It's something that I think that we all need to have some knowledge about, because the devastating injuries that the high-velocity projectiles or low-velocity projectiles can cause are something that we really need to know about. For example, you know, one of the big deals about the shootings in Orlando was the use of a quote-unquote military-grade weapon. Now, a lot of the wounds that we saw there were actually through-and-through wounds. A lot of the survivors actually had through-and-through wounds, and the people that were behind them were the ones that received the actual devastating injuries. And that speaks volumes of the kind of weapons that were used, but not only that, but the actual injuries that these weapons would cause. So I started doing some research, and I wanted to see if this was just me or if this was something that was true. And as we see here, this paper from 2015 kind of did a review of ATLS guidelines, and I know that a lot of it has changed in the past 5 years. They've come out with a new edition of the book, but they put together a little test here, and we can see that before they took this introductory course to ballistics, there was a lot of misconceptions about certain kind of wounds in military individuals. I'm sorry, in civilian individuals. And if we see out of the individuals that actually took these tests, 57% of them had actually had ATLS. 50% were current, 7% were not. And there was no experts on ballistics, but there were people that had some knowledge of it, and therefore it was shown in this review that although you might believe that you have a good understanding of the interaction of bullet and tissue, sometimes our beliefs can be flawed with some misconceptions. So that's why I chose this subject. General Air Force disclaimer: this is me talking, not the Air Force, not the people in uniform here, which we have a lot because we have Green Dot training right after this. So basically, I'll review what I'm going to talk about. I'm going to talk about some military weapons that I've used in the past. So what is an actual assault weapon? Talk about ammunitions, ballistics, wound characteristics, and myths. So we're going to jump right into it and talk about the first weapon that I shot many years ago, although I feel old when I say it was 2000, but then I look around the room and I get the dirty looks that I'm not old. So I'm just going to say in 2000, when I went to basic training, I had the privilege of shooting the M16 rifle, which was, not sure if you would call it a privilege per se. It's a long, bulky rifle, heavy, big enough to actually carry a cleaning kit in the buttstock. So that makes it too big. But as we can see, it's a heavy, 7 pounds when it's 100 degrees outside and you're full kit, and 7 pounds can unload it, can be a big deal. This is it was in 2 versions, fully automatic and semi-automatic, and actually as well as a 3-round burst. It fired the 5.56 round NATO. But then when I got to my unit, yeah, that's me, a little skinnier than I am now. I was assigned the GAL-5 rifle. So the GAL-5 rifle has a lot of history in the military, and to the untrained eye, the GAL-5 rifle looks exactly as an AR-15. Well, to the trained eye, it looks exactly like an AR-15. So it looks about the same. So, but this one was a lot lighter, 6 pounds, and I know that 1 pound for you guys is probably not much, but try to losing it, and you'll see how hard it is to lose a pound. And carrying in combat is even harder. But this rifle has been in service, or was in service, since 1966. Both this one and the M16 were around the time of Vietnam. And the big thing about the GAL-5 was the rifle mostly used by Army Special Forces and U.S. Special Forces, especially during the Son Troy prison raid that was the biggest POW rescue attempt in Vietnam. So, and it was used mostly because of its versatility. It was small. We didn't require to engage targets at long distance, and it was very easy for what we call close quarter battle. So that's why this was the preferred rifle for special operations for most of the time until early 90s. There have been other rifles used, however, the ones that are on the books are these ones that I'm discussing here. The M4 rifle was introduced in the late 90s, and when I first had a chance to shoot it, it was about 2001, 2002, and I felt like a kid in a toy store. It's very easy to shoot, very friendly, I guess from this point, not from that point. And it was it was slightly heavier, and we made it even heavier. Although you would think that we kind of went away from it, from the M16, because it was too heavy. But we proceeded to add a bunch of stuff on it to make it even heavier than what it was actually intended to. But it made it more effective. This was also the GAL-5 was actually fully automatic, but we realized that the accuracy of a fully automatic weapon was very low. So we went to a 3-round burst. We never really used 3-round bursts in combat, and I know that Hollywood depicts almost every military movie where you fire in fully automatic weapons or 3-round bursts, but the reality is that single shot is our preferred way of engagement because it's a lot more accurate. Now, this weapon was flawed with problems. We had a lot of jamming issues in the desert, and the military, instead of getting us a new weapon, since they already invested millions of dollars in this one, they just threw more millions of dollars into fixing it. The people that could, like the Combined Arms Group, or also known as Delta, and SEAL Team 6, opted to just go away from the M4 and started using other weapons made by competitors like H&K and the SCAR from the Brits. So the pistols that we used in the military were the Colt 45. It had been present since 1911. That's why it's called the 1911. It was in service until around 1986. This was a heavy pistol that we carried around. It weighed about 2.4 pounds. It was long, not that much longer than the Beretta, which is what I carried in combat, but that's kind of cheating right there. As you can see, this one is flushed, but you could attach a suppressor here. And it weighed, the Beretta weighed a little bit less than its predecessor, the Colt 45. And it actually, the Beretta was one of those weapons that was a big issue when it was assigned to the military, because it was made by a foreign country, and therefore it wasn't an American brand, and if it was felt that we were taking the money outside of the U.S., but it won all the competitions, and it made for the best pistol for us to use in combat. It didn't jam. It was very effective. And the bottom line is, if you were using a sidearm in combat, then you probably wanted to have the 15 rounds, because when it came time to use a sidearm, you probably were deep into it, and you didn't have time to reload your rifle, so you want as many rounds as possible. But we ran into some problems in Afghanistan. The use of our targets or our competitors in Afghanistan use a lot of opiates. They were constantly high, and the engagement with with a 9mm round did not quite stop them. So they kept on coming as many rounds were put into them, and it was believed that 7 to 8 rounds would take one individual to put them down. So we went back up to the 45 during the Afghanistan war. Mostly the Special Forces guys, mostly Army Special Forces guys. To me, I rather carry the smaller one and slightly lighter, because if I was ever using it, I definitely needed the 15 rounds. They were a little more versatile, and they were able to use the 7 rounds of the 45. However, after 5 or 6 years of carrying it around and lugging that big piece of weight around, they realized that, it's not really the bullet size that matters, it's where you place your rounds. So we went back to the range and went back to the basics and started focusing on our precision shooting. And long and behold, we went back to the 9mm Beretta, because it seemed to be a more versatile weapon when it came to jamming and when it came to a weight for carrying around. So I'm going to transition now into the civilian side, and we're going to talk about assault weapons. And there's been a lot of controversy, and the purpose of this talk is not to be for or against it. It's to actually explain to you what an assault weapon is. When most people think about assault weapons, they think about fully automatic weapons. And fully automatic weapons have been banned since the 30s. You couldn't really purchase one. But it was in 1986, during the Firearm Owners Protection Act, that they actually became completely legal. You couldn't purchase it, you couldn't own it, and you couldn't transfer it unless you had a very special license, which almost nobody gets. I remember being a kid and seeing the movies in the 80s, like Lethal Weapon and stuff like that, where Uzis were like the thing. That's what everybody shot. It was a 9mm fully automatic pistol that everybody used, and the Tech 9, which was also one of those that everybody used. And as the time has gone by, we've seen less and less of those in Hollywood. However, we do see that they show weapons like the AR-15 as to being a fully automatic weapon, but they've actually been banned since 1986. So what does constitute an assault weapon? Well, here's what constitutes an assault weapon. So a semi-automatic rifle that has a detachable magazine, like every other weapon, and at least 2 of these. So a telescopic folding stock, which is what we had on the M4, which had a 3-way collapsible stock, and the Gal 5, which had a 2-way collapsible stock. A pistol grip, bayonet mount, and if you're fixing bayonets in this day and age, then you're probably going to be in a world of hurt. Flash suppressor, and a grenade launcher, which I think is a little excessive anyway, so I don't know who needs a grenade launcher to take care of anything. But none of these things up there actually affect the actual accuracy or the engagement of the actual weapon. It still fires a .223 round, which I will go over here in a minute. And the actual accuracy and effect of it is still about the same as it is with all of this. And if anything, grenade launcher would actually make accuracy a little harder because it's a little bit heavy. Now, when we talk about assault weapons, we think about assault rifles alone, but it also comes in the variety of pistols. So what is an assault pistol? So an assault pistol is a pistol modified to carry magazine on the outside of the grip, meaning that now you have a bulky grip, harder to grasp, but easier, I guess, to reload. You have a thread for the flash suppressor, or some place to place a forward grip. The actual barrel is encircled, so you can hold it with 2 hands, like a rifle. A way heavy pistol, which I'm not sure why anybody would want to carry that around. And a semi-automatic version of an automatic firearm, which this kind of always gets me, but basically if you have a pistol that looks like a Uzi, then you're carrying an assault weapon, and obviously for me it's not, I don't see it as a big deal, but I'm sure that for law enforcement, identifying these is a big deal, so that is understandable. So the AR-15, yes, I am a proud owner of an AR-15, and it's basically almost the same rifle as you would see with M4, M16, and Gal-5. However, the inner workings are completely different, meaning how the trigger functions, how the chamber is created. Although everything else is pretty much the same, the actual ammunition that it uses is a .223. Now, when you look at it, and I'm going to go over that in a second, .223 and a .556 is essentially the same round, but it really isn't. So, you know, people always ask me, why do you need an AR-15? Why do you carry around an AR-15? And the answer is simple. When the zombie apocalypse comes, okay, you don't want to be firing a pistol at ground level at these guys rushing you, okay? You want to be sitting at 400 to 500 meters on a rooftop, sipping a mojito, engaging these guys, okay? Now, I'm not advocating that you shoot a weapon while you're drinking a mojito, but in a zombie apocalypse, come on. Anything is game, right? So yeah, so that's why I practice with it, and that's why I like it, and it also gives me memories of my old days, and it keeps me at ease. So when we talk about the Remington 5.56 versus the .223 round, right? So essentially the same exact round. Green tip is the .223. The non-green tip is the NATO round. This one could also come in like orange flavors and stuff like that for tracers. But when we look at it, the 5.56 is a hotter bullet. It is packed a little tighter, and it carries a lot more oomph behind it. So the velocity that you could expect from a 5.56 is actually more so than a .223. And you can read through this and see that you can fire a .223 round in a 5.56 made chamber, but you should not fire a 5.56 in a .223. And this was very evident for us in combat, where we were very, very concerned about collateral damage when we would do our close quarter battle. Not so much in Afghanistan, because in Afghanistan you have mountaintops, you're pretty spread out, and the engagement of this is actually fair distance, so you want that extra velocity that the 5.56 affords. But when you're going house to house and you're shooting through these mud huts, you want to make sure that your bullets don't go through the walls and don't affect people, innocent bystanders that are behind. So we actually went to the .223 to afford us a better control where our rounds would end up at. There was a lower velocity that made things slightly better. Now, when you're talking about a couple of 100 feet per second, it might not make a big difference in the outside world, but when you're confined into a building, it is actually a huge difference. So let's talk about the evolution of the military bullet. So in the 1890s, the British acquired a new shiny rifle that was very, very effective at a long range, and they thought it was going to be the best thing since sliced bread. And however, during the Indian-British conflict, they realized that these rounds were just not as cool as they thought it was. So the wounding capabilities of this were actually lower. They were not affecting their targets as they wanted, and they had a lot of through-and-through rounds that were not really having the effect on their targets as they wished. So therefore, they filed off the tip of the bullet, and they created more of a flat surface of it, creating what was known as the dum-dum bullet. And what this did, it took away the full metal jacket of the bullet, which I will talk about here in a minute, and allowed the inner core to be exposed. And that caused some devastating injuries to the targets. Therefore, in 1899, the Tsar from Russia decided to call in the Hague Peace Conference. If you can have a peace conference for war, that's what they were doing. And they banned the dum-dum bullet, saying that it was too damaging. Now, I guess not all is fair in love and war, but because dum-dum bullets are not fair. So in 1907, the Fourth Convention of The Hague and wrote in Article 23 that forbade the use of arms and projectile materials calculated to cause unnecessary harm. I guess unnecessary harm is kind of a legal term, and you can kind of decide what unnecessary harm is. But basically, I think all bullets cause harm, but the military bullets were made to cause less harm. But in 1960, not learning from our British colleagues, we did the same mistakes that they did in 1890, which is basically we took the M16 rifle and we thought it was going to be the best thing. The reports came out saying that it was going to be a round that would knock out limbs, and what we found was that most of these bullets just had a through and through of the targets and didn't really cause much damage. There was maybe a little bit of tumbling into it, but really didn't cause much effect. Therefore, some modifications were made to the M16 and to the bullet, ensuring slightly lower velocity and better impact. However, the actual design of the M16 was to be able to engage targets at 800 meters and fully winter close. So to come down from that made it a little difficult, but it was remade so that it wouldn't be as fast and cause more harm, but not more harm than necessary according to the Hague. So there's several ammunitions, and I'm going to focus, for the sake of time, on jacketed bullets. And so a full metal jacketed bullet is that in which it's a lead cover of the actual bullet that protects the inner workings. And it was because of this bullet that we were able to have high velocity projectiles shot from rifles. Other than that, it would strip and it would fall apart in flight. Then we also have the partially jacketed ones, which flatten like a mushroom or mushroom when they hit the intended target. As you can see here, that's a full metal jacket, and that is a partially jacketed. In this case, it's a hollow point. Is also known that what they do with these bullets, they also take the jacket off and they leave the core exposed here without hollowing it out. But both those will actually expand in tissue. And it was shown in studies of using porcine heads that full metal jackets would go through and through and causing minimal damage to the surrounding tissue, but hollow point rounds and rounds with the tip exposed would actually cause more damage. Hollow points being the most damaging, and the ones with the tip exposed causing less so damage, but not a through and through wound as we would see with a full metal jacket. So everybody talks about stopping power, right? What the bullet and stopping power, and what exactly is it? Well, not in legal terms, but in terms that we use, is stopping power is what's going to incapacitate the individual in his tracks. There's really only two ways to do that, and that is to a high spinal cord injury or a brain injury. Shooting in the bones of the legs will stop the individual, but he could still be a threat and still move. So that's why we went back to the range, and we focus on our grouping, and instead of going up on the 45, we went back down to the 9mm, focusing it specifically on this. So what does this mean? Basically, this means that having a higher velocity round is not necessarily what's going to be the best bullet to stop a target, but it's actually well-placed round is what's going to stop the target. Now, lethality really refers to the actual power of the bullet killing. So when we look in the trauma bay, and we have these patients, they can either die in seconds, die in minutes, or take days to die from a bullet wound. So lethality is not really linked to the stopping power of a gun, but more of the effects that it can cause in the long term. So let's talk ballistics. So when we talk ballistics, it's basically the science that studies how the bullet reacts with its within the rifle, flight time, and on the body. And this is, just like I said, is divided in three segments. The internal ballistics, which studies the propulsion of the projectile inside and how it leaves until it leaves the barrel. So this is each weapon has a firing pin that engages the primer on the bullet that excuse me, heats up the propellant and has with the gas expansion propels the actual bullet. This goes through the barrel that has has the spiral in it, and that leads to the rifling of it. Then when it leaves, it actually, in high velocity projectiles, it's going to leave at approximately a 6-degree yaw, and it's going to proceed out to a flight path with more of a parabol, with its vertex just parallel to the ground. However, the flight varies depending on distance. So when we look at intrinsic factors, we look at the actual bullet and how it was propelled. So the form of the bullet dictates is going to dictate its trajectory through the air, and extrinsic factors such as wind friction and gravity are going to affect the actual path of the bullet. So, sorry about that. Then terminal ballistics is the actual effects that it has on the tissue, and we're going to go over that here in a second. Wounding power is so there's two basic parameters: mass and velocity. So most people think that it is said that the kinetic energy possessed by the projectile, the impact, is thought to be provided by an estimate. It provides the estimated wounding power, and this is calculated by kinetic energy is half times mass times v squared. But the reality is that this is we've seen that this is a lot more complicated than this. Okay, the mass actually provides really important aspect of this equation, and not only the velocity. Where v is squared, you would think that the velocity actually increases the wounding propensity of the round. However, higher mass indicates better inertia through the air, which indicates higher hits or stronger hits on the body. So when we look at the projectile tissue interaction, we see that bullets that come to rest within the body without deforming or losing a substance actually transfer their entire kinetic energy to the body, meaning that a low velocity projectile is more prone to transfer this kinetic energy into tissue than a high velocity projectile that just perforates and goes through the body. And we'll talk a little bit more about that here in a minute. So as we can see here, we can see this is these are two individuals who likely had self-inflicted wounds from either cleaning their loaded weapon, as they often do, or using the weapon under inappropriate conditions. And here we can see this is a full metal jacket round. It goes through and through. And here we can see this is a hollow point and likely shot at an angle, leading to a bigger entry wound. This guy went to the hospital. This guy took care of it at home. So I'm not sure who did better or who still has a foot, but probably neither one of them. So two components of wound trauma. So we have the permanent wound cavity. Okay, so the permanent wound cavity is going to be the path taken by the bullet, and while it's crushing effect and destroys the tissue, that's a palpable tract. And we have the temporary cavity, which is radial stretching tissue around the bullet's wound tract. So this is like, say, an Olympic diver jumps in the pool, makes a little splash, almost no splash, goes straight down, comes out of the pool. I jump in the pool, and I have a bunch of ripples because I am not an Olympic quality diver. I'm not a diver at all. So I'm going to make a lot of ripples in the pool. So that's what we see with the temporary cavity. So the temporary cavity, this is a very controversial subject, and it's been described in many papers as something that we see mostly with high velocity projectiles. Sometimes we see it with low velocity projectiles, but it's believed to be insignificant. And it's also believed to be overestimated based on the fact that we do most of our research on gelatin models, which does not really predict the effect of a bullet in tissue. The reason I say that is skin actually has more elasticity. There's more fascial planes, and it's stronger than simple gelatin models. So when we've done studies of M16s and gelatin models, we've seen that the temporary cavity can extend up to 18 centimeters. However, that same bullet, same rifle, taken into the muscles of dogs, which were properly anesthetized and taken care of, showed acute damage in the temporary cavity limited to only 5 centimeters. And this was minor enough that it actually resolved within 72 hours. So the gelatin model doesn't really translate to what we would see in the actual tissue. Most of the effect of the temporary cavity is going to affect hard organs or organs with more tensile strength, like the brain, liver, and muscle. We can see in the brain rapid expansion by either high power rifle or low power projectiles that lead to the explosion of the actual bones in the skull. However, the lungs are least affected by this, and meaning that there's less temporary cavitation of the lung, and most of the injuries that you're going to see in the lung tissue is going to be from shreds of bone from the reaction of the bullet onto these bone fragments. Now, the peak of the temporary cavity is produced by non-deforming bullets. It's not going to be at the entry point. It's actually going to be where the bullet yaws about 90 degrees. So, as we see here, better explains it. This is a paper from Faulkner done in late 1990s, and he's believed to be one of the most knowledgeable person in the literature of ballistics. And we see that in high-velocity projectiles, the projectile enters, creates a cavity. However, when it starts, I swear it's in there, I'm not sure you guys can see it, but these are little bullets. And when it starts to kind of tumble, it's actually about roughly 25 to 30 centimeters inside the tissue. So you got somebody that's, skinny like I used to be. You're going to have less damage going through the cavity as a person that's obese, where you're going to have a little more effect of the actual tumbling in the cavity. But when you shoot, when the extremities are actually injured, you see a lot more of a through and through pathway, because it doesn't allow for that for the bullet to actually tumble within the tissue, and it's going to be just a straight permanent cavity, and it doesn't allow for the temporary cavity to actually form from the tumbling of the bullet. The bullet eventually finishes, it tumbles once, if at all, and it eventually travels backwards outside the body, creating the temporary cavity, as we discussed. It's about 5 centimeters in some studies. Down here we have a low velocity projectile, which we can see the dissipation of energy is going to be at impact, and there's going to be a temporary cavity that's not that does not cause as much harm as the one seen by high power rifles. So the permanent cavity. So what is the permanent cavity? It's the visible tract. Sometimes it collapses upon itself, and it's surrounded by an acellular or endothelial damage, which it's surrounded by a cellular endothelial damage, which it could be seen kind of like a bruise. The microscopically, however, this area of contusion, or also known as the site of a hemorrhage, is going to have the hemorrhage non-viable tissue. And the pathology is going to be concurrent with necrotic myocytes. This part eventually softs off and becomes part of the permanent cavity. Now, the contusion zone is surrounded by the concussion zone, characterized by a grossly normal muscle, with histological evidence of potentially reversible damage. Tissue disruption and damage are most extensive where the energy transfer has been the greatest, and in deforming bullets, such as the hollow point and those that are the tip file, like dum-dum rounds, this is going to be at the entrance site of the wound. However, in non-deforming bullets, this is actually going to be where the bullet actually starts to yaw about 90 degrees. Some studies of perforating wounds by military rifles in the hind legs of anesthetized animals show that unless there is actually a great vascular injury or bony injury, most of these injuries will heal without need of extensive debridement, as long as the wound is open enough to allow for it to drain out. So let's talk about some myths that have been placed in, that are out there in the literature, is that high velocity projectiles cause more harm than low velocity projectiles. Well, this is when we look at at the actual injury pattern at a close proximity, or the same proximity for a rifle than for a handgun using a hollow point round or using some sort of a heavier projectile, we see that we have through and through rounds with a high velocity, and we have actually full dissipation of kinetic energy with low velocity projectiles, and this leads to a bigger hole and more injury. Next one is that wide excision of tissue is mandatory in high velocity wounds. Well, this is not always correct. Like I said, some wounds can leave a large enough tract that it could actually drain itself, and most of the literature has caught up to this, to the fact that we don't need to do 20 to 30 times the actual size of the bullet for the debridement, but only kind of excise, if needed, a small portion of this. Schwartz has not caught up to this yet, and hopefully in the future versions it will, but it still calls for wide debridement of tissue. Bullets are sterile after shooting, and so this is, Streptococcus bacteremia was the most common cause of death victims in the battlefield pre-antibiotics. After antibiotics were introduced, we saw that 5% would die in World War I, 0.7 in World War II, and 0.0 in the Korean War. In Iraq War, patients treated with antibiotic prophylaxis after a penetrating wound had a lower rate of infection than those that were not. Multiple studies have shown that bullets shot from a rifle have inoculated with strep or staph still have it upon impact on the gelatin-based model. I know I didn't talk about shotguns very much, but one of the myths that is seen in the ATLS old version, I know they just recently updated, but basically the shotgun wounds lose their potential for devastating injury at more distance. And although that is true, they're still lethal to about 150 meters, and that's because initially when they talk about the birdshot and a lot of pellets, but the buckshot could actually go out farther and actually cause harm. Exit wounds are larger than entry wounds. There's a paper out of Germany that compares this in different models, and it really depends. And although this can be often true, and through wounds in a small area, you'll see the same size in and out. If individuals shot within the first 100 meters with a high-power rifle actually have a yaw of the bullet at about 6 degrees, can actually create a larger entry wound than the exit wound. And although we often think to know which one is the entry and which one is the exit, bullets that actually exit before creating a permanent cavity have roughly the same time. If they exit during bullets that actually exit during the temporary cavity have shown to have a larger wound than those exiting during the before or after the creation of a temporary cavity. So some myths from Hollywood. Bullets must always be removed. We see Rambo with his Rambo knife heating it up, trying to pull the bullet out, and we see in many movies how they go after the bullet and try to take it out. Well, unless the bullet is lodged in a place where there is close to synovial fluid or a vertebrae, we shouldn't really go in and need to fish it out, as we've left many of these in. Bullets have kinetic energy to knock people back. Well, Newton's third law of motion kind of argues against that one. I've never seen anybody get knocked back from a gunshot wound, and every action has an equal reaction. So if I'm going to shoot somebody and knock them down, I'm probably going to knock down myself while engaging the target. So that's something that's not very true that we often see in the movies. So in summary, military weapons and civilian weapons have some similarities. However, civilian weapons can be more lethal than military weapons. So let's not blame it all on the military weapons. Velocity of a bullet alone does not determine wounding capacity, as we see, as we just saw. Overestimation of the temporary wound cavity can lead to unnecessary debridement. Therefore, this is where the experienced trauma surgeon comes into play and can better assess that. Overestimation of temporary wound cavity, antibiotics should be given to all gunshot wound victims, as it's been shown to decrease the amount of infection. So I want to thank you very much. I want to thank my wife and daughter who are here today with me, and my son for putting up with me for these past 4.5 years of torture. and not being home and missing dinners and such like that. But don't worry, we're almost done. Less than a pregnancy to go. So looking forward to it. And I'll take any questions you guys may have. Thank you.
We have time for a few brief questions. This is always a great tradition of the chief resident lecture on any topic of choice, and it really was an enlightening and
Thank you.
New version of kind of what we've seen. So really, really provocative.
Question to Jason or the trauma surgeons here who treat both low velocity and high velocity wounds, many calibers, many loads. How do you estimate the extent of debridement that's necessary to get optimal results? Are there special tricks to examining the exit wound when you do debridement to open up the tract? Do you just look for viable tissue? Is that a reliable guide? I
think that comes mostly with experience and evaluation of multiple of these wounds, and see what exactly is going to heal, what exactly is not. Not being a trauma surgeon, it's hard for me to answer that question. But I would say, but based on the data that I've read, maybe even waiting a little bit before actually proceeding with a debridement, you could actually see what tissue demarcates and which tissue is not gonna live, and it's gonna cause further harm to the patient.
Did get the impression from the vascular surgeon perspective to keep the bullets out of the way of the blood vessels.
Yes.
Can you address the lead content of the projectiles, especially when we think of that in the kid? When we think of California condors and what has been legislated as far as trying to eliminate lead bullets in the state?
I think the concept of lead causing intoxication is more prominent when it's close to, like I said, to synovial fluid, or more close to it, where it could actually get into the bloodstream. A bullet lodged in a cavity which is not in direct contact with the main bloodstream is not going to be something that should necessarily be aware to be much concerned about. Now, I'm not familiar with the California constructs of lead in children, especially treating mostly adults. So I apologize for that.
All right. Thank you very much.
Thank you, Dr. Farmer. Thank you very much.